Welcome to A Dose of Reality, the truth about the vaccines. I'm Ron Ponder. In this special presentation, we'll give you accurate information from people of color to people of color, people who are in the trenches every day with the virus and the vaccine. What are the true facts of the virus? What are the true facts about the vaccines? Here is where you can get accurate, important information that can be very useful to your family's health. I can't wait to get my shot, and I'll do that as soon as it's my turn. The following information is the gold standard, the gospel when it comes to information about the virus, the vaccine, and minorities. We know the questions that many of you may have. We know some of you may have doubts. We also know that some of you may even be wondering where you could get real answers. Well, here we are. And we start with Dr. Jamesetta Lewis, a practicing physician at the Cleveland Clinic Mercy Hospital, who will briefly explain how all of this affects us minorities.
African Americans, we're 2 to 3 times more likely to die from this virus. And that's for a variety of different reasons. And a lot of it is because as Black Americans, we have a large amount of those severe chronic illnesses that essentially put us at risk for getting the virus. When I talk to my patients about this in the office, I always tell them to make sure you're getting accurate information from the Centers for Disease Control and Prevention, the CDC, because that's where we as physicians and healthcare providers go to get our best evidence and medical information. So on the website, when they talk about high-risk patient, what makes me a high-risk patient from getting severe illness, that means what are my medical conditions that put me at a greater risk of being hospitalized, being admitted into the ICU, being on mechanical ventilator, intubation, or death. And so these are what they recommend right now as high risk factors for adults. And it starts with cancer, chronic kidney disease, COPD, which is chronic obstructive pulmonary disease, Down syndrome, and sickle cell disease. They just added to the list as of December the 23rd. Heart conditions like heart failure, coronary artery disease, anything that has a weakened immune system from immunocompromised states like cancer or organ transplants, obesity. If you have a BMI of 30 or anything greater than 40, you are at risk of developing severe illness, pregnancy, and then of course smoking, and then type 2 diabetes. And then after that, they then list other medical conditions that most likely would still put you at high risk, but not for severe illness. And then that goes even further into if you have asthma, if you had a stroke, cystic fibrosis, hypertension, liver disease, dementia or Alzheimer's. Same thing with being overweight or morbidly obese again. Something called thalassemia, and then of course you have the pulmonary fibrosis and the type 1 diabetes again. And these are specifically for adults. Now children are a whole nother category. Since we don't still have a lot of strong evidence about children, they're saying any child that has an immunocompromised state will automatically put them at severe risk, severe risk, like I said, which involves hospitalizations and ICU admission and death.
And the fact of the matter is, no, you cannot get sick from the vaccine. You cannot get coronavirus from the vaccine. It doesn't have any live virus in it. The way it works, it has a protein that they use that's been modified and created to make your immune system work to fight against the virus. So when you have, some of these side effects, such as, pain in the arm or a little bit of a mild fever, or, something like a little bit of a chills, it's actually your immune system at work. It's responding to what the vaccine is intended to do. So just like in childhood, when a kid gets a vaccine, they get a little bit of a redness or illness, fever. It's the same concept. So it's not that you're getting sick, but you can get side effects from the vaccine.
We keep hearing about these vaccines. Just how safe are they?
Yeah, safety is one of the big questions with this vaccine, right? Because it's fairly new. It's been, everything about coronavirus is new. That's why it's called novel coronavirus. The vaccine itself has actually, the technology has been around for about a decade or so. It's just that the timing of the vehicle wasn't there. And so when coronavirus came about, it's the right time to use this type of technology. The CDC, which is the Centers for Disease Control, the FDA, which is the Food and Drug Administration, and the ACIP, or the Advisory Committee on Immunization Practices, they've all been these organizations that have looked at this vaccine, the two vaccines that are out there now, and they have pored over them, the scientific data, the two trials that were done to make sure that it was safe. And they've used a diverse amount of individuals in their trials. So they've had Black individuals, they've had Pacific Islanders, they've had white, Latino, Latinx communities, and their determination was that this is generally safe for most people, for the general public, and it's the best thing, as a matter of fact, to stop the spread of COVID. That being said, again, side effects can happen with a vaccine, and so those side effects will continue to be monitored over years of getting this vaccine, and hopefully COVID's not with us that long, but it will continue to be monitored. But overall, this has been determined to be a very safe vaccine and very important for stopping COVID-19 from affecting our communities.
There are several vaccines on the market, with others coming. How do you choose which vaccine may be best for you?
The thing with the vaccines, at this point in time, you're kind of at the mercy of the facility, because it's not like you walk in and you say, oh, I want the Moderna vaccine or I want the Pfizer one. You kind of have to go with what they offer you. So both of the vaccines work the same way. They have what is called messenger RNA. And basically, when you get the vaccine, it prompts your body to make a protein that will issue an immune response. So it's not actually the live virus that you get when you get the vaccine. And what this protein does is, if you are exposed to the virus down the line, it triggers an immune response that will help you fight off the COVID vaccine, the COVID disease, if you would get it. So the thing with the vaccines is that Pfizer has to be kept super duper cold, like at negative 94 degrees Fahrenheit. It has to be shipped like that, and it has to be stored super cold like that. So a lot of facilities don't have the capability to do that. And then there's also stipulations with that, like once it's thawed, it's good for 5 days, but then once you open a vial, it's only good for up to 2 hours. So that's an issue. And then with Moderna, that is just at a standard freezer temp of the negative 4 degrees Fahrenheit. And it can be stored in a freezer for up to 6 months. But once you open that vial, you have 12 hours to use it. So that gives you a little bit longer leeway. So, if you're in an office, you have your whole day to use it instead of just a couple hours. But you're still at the mercy of the facility as to what vaccine you get. You can get COVID more than once. It's not like a one and done. You would like to think that once you get it, you have antibodies to it, but we don't know how long you have the antibodies. So they're saying within 90 days of an infection, you won't get another one, but it's possible to get it 4 months later, 6 months later. But yes, you can definitely get COVID more than one time. What they're hoping is that with the vaccine, though, it will limit that because you'll have the antibodies to it. But we don't know how long you have those antibodies for. And some of the, you can get really, really bad symptoms with COVID. And what they're hoping is that if you get the vaccine, if you do get COVID a second time, it would be less. It wouldn't be like you would need a ventilator. Maybe you just have a cough or a runny nose or loss of taste and smell.
Why is it that we need 2 doses of this vaccine? Why can't I just do one? Matter of fact, this last week I spoke with someone who said, you know what, I'm going to wait until we have the 1 dose option. She was, a little older in age. And I advised her that the reason why there's 2 doses is because at this point in time, the 2 vaccines that are available are the Moderna vaccine and the Pfizer BioNTech vaccines. Those have been approved by the FDA for general public use. Both of those vaccines require 2 doses. The initial dose is almost like a primer. It helps to get your immune system ready to recognize the virus. And then the second dose is almost, it's this booster, almost helps to keep the immune system ready. With the Pfizer vaccine, it's 21 days after the initial one, and the Moderna vaccine, it's 28 days after that initial one. Again, that first one's like a primer, and the second one is a booster to make sure that that you get the most benefit from the vaccine.
And that's another unknown. Because of the limited evidence right now, I think that is going to be ongoing information as we move along with the information from the science and the clinical trials and the vaccine. We don't know how long the immunity will last when we get the vaccine. We can only look at our own natural immunity, which varies from person to person. So if I get the virus and I build up an immune response, I'm able to fight the disease, I don't know how long my natural immunity is going to last. It could be 3 months, it could be 6 months, it could be a year. Same thing with the vaccine immunity. We don't know after someone gets the vaccine, how long will that immune response last? Some evidence is pointing to hopefully it'll last for years, but we just don't know that clinical information just yet.
We've said how safe the vaccines are, but why should people really get the vaccine?
The question, why should I get the vaccine? I think probably about every patient I talk to about the COVID vaccine is right there on the forefront. So in response to that question, we're all, again, going through something that's new and different and disruptive to our ways of life. I don't think anybody has experienced something like this in their lifetime unless you're over 100 years old. And you have a faint recognition or a faint memory of the Spanish flu back in 1918. But the question is usually centered around, is it ethical? Should I get it? I have mistrust of the healthcare system. I have mistrust of the government. And to that point, I would say there's valid reasoning for that, because there has been unethical, terrible mistreatment of Black and Brown communities with regard to healthcare experimentation and things like that. However, that being said, this coronavirus that we're facing now is unlike anything we've ever seen in our lifetime. And it's affecting Black and Latinx communities at rates that are higher than white communities, than many other communities. And because of that fact, both in hospitalizations, people being hospitalized from COVID-19, that's higher in Black communities and Latino Latinx communities. And deaths, COVID-19 is about 4 to 5 times higher in deaths than in majority white communities. And so because of that reason, it's important for us to get the vaccine, for minority communities to get the vaccine, and for majority communities for the protection of the common good.
African Americans, we're 2 to 3 times more likely to die from this virus. And that's for a variety of different reasons. And a lot of it is because as Black Americans, we have a large amount of those severe chronic illnesses that essentially put us at risk for getting the virus. So we're already disproportionately being affected by the virus, but when you look at the vaccine numbers, there's a very large underrepresentation of African Americans actually in the vaccine trials. So when I looked at Pfizer and Moderna, those are 2 examples I want to give you. So Pfizer had a total of about 41,000 participants in their study, and Moderna had about 27,000 participants. And when you look at Pfizer, out of those 40,000 participants, about 42% of those were white and only 9.8% of those were Black. When you look at how many people actually participated in the trial. When you look at the Moderna vaccine, out of those 20,000 participants, 79.4% for white and only 9.7% for Blacks. So we're being largely affected by the virus. It's killing us at 2 to 3 times the rate, but we're being underrepresented in the number of people who actually participated in the clinical trials, which is why it's so difficult to get long-term information and data about how it's going to affect us. when we have the vaccine. And the only way to know that is by continuing to collect data and information, encouraging people to participate in the trials, participate in the vaccine so that we can get more information about how it's going to affect African Americans moving forward. The only way we're going to get that information is by people participating.
The more people that get vaccinated, the less chance that there is of continuing the spread, and the less chance there is of continued deaths from coronavirus. And so at the end of the day, I say something, this is an individual decision. Everybody has to weigh this for themselves. It's a risk either way. You risk not getting the vaccine because you could spread it to family members and somebody you love could be affected. You risk when you get the vaccine because, again, we don't have all the information about the long-term effects of this vaccine. However, with the information we have available to us right now, the risk is greater with the effects from the coronavirus infection than the long-term effects as it stands right now.
State Representative Thomas West will answer the questions about outreach. How do you get more accurate information and more outreach?
You know, I'm a big proponent of outreach, and that's always been historically how we can reach the Black and Brown communities, is going to them. There's so many things going on in our lives on an everyday basis, a lot of fear, and there's some people not even going out of their apartments these days. So it's important for us to be able to provide that outreach. And if we can't do it in terms of getting the professionals to the families, then we need to be able to send out our community health workers, our navigators, our case managers, our homemaker and personal care people, and utilize all of these different avenues to be able to take laptops to those homes and create an appointment for those individuals to show up, and then provide the transportation necessary to get them the vaccination. When we do that, then this virus will start to decrease. I was telling somebody the other day, a number of individuals are not being able to access through virtual. And I can say this, they get on lists, but then they don't even realize what list they're on. And then there's some people that don't even have access to the computer to get an appointment. And that's why it's so important for us to provide outreach to our urban leagues, access to our food banks, and our churches. And these are things that we know that if we had it at those places, people will then be able to get those the vaccination needed.
As Representative West mentioned, registering for the vaccine could be a challenge, but there's some help to do that. Most of you may know retired educator Cleo Lucas, who volunteers to register people.
I remove obstacles, and one of the obstacles for most of the people, they don't have computers, they don't have internet, they're just frightened of how to go in and register. So it only takes 2 minutes, and many times less than 2 minutes, but most of the time 2 minutes if I'm registering a husband and a wife. So just helping to, when we talk about dispelling myths, is getting people registered. And I just don't think that should be an obstacle for anyone. Stark County is so different. We have 4 health departments. So the first thing I ask them is about their address, where they live. And if they live in Canton City, then they have their trash picked up by Canton City Sanitation Department. And that is that's a green light for me. Yes, I can register you with Canton City. So I need to know where you live. And from there, if they don't live in Alliance, Canton, or Massillon, then they live in like Perry or North Canton, I registered them for the Stark County Health Department. If you are afraid of the technology and how to register, ask your grandchildren. They can come and register you. Ask your children. They can register you. Don't be afraid, and don't allow your lack of technical skills to stop you from getting registered for the vaccine. I think it's 6 questions, and 2 of those are yes or no. So it's really important for them to know that it's easy, it's not frightening, but they need to ask someone to please help them get registered. And on a daily basis, Ron, I might register anywhere from 5 to 10 people, and that's only a maximum of about 50 minutes. So it's not something that's difficult, it's something that I'm committed to doing.
What advice do members of the clergy have for members of their congregations regarding the virus and taking the vaccine?
Yes, our congregation, they do have concerns with the COVID vaccine. And my response is just like anything else that they have faced. And that is, we face it with faith, because there are things that come along that's out of our control. And this is probably one of the things that has been most out of our control. And anytime we're in situations where things are out of our control and there's nothing that we can do about it, that's when we elevate our commitment and our trust and our faith in the Lord. Because even though it's out of our control, it is never out of His.
I know that a lot of people has been impatient in acquiring a date or a slot or calling the health department or even the local pharmacist and getting your vaccine. I just want to let them know to continue to call, continue to dial that number that they saying there's no answer, or even if they take your name and your number and they say they're going to call you back, because it is so important that we all get the vaccine. In order for this to work and we get back to normal, we still have to get that vaccination done. And we still must continue to do the things that we were doing before to prevent getting COVID-19.
So I would definitely like to direct anyone who is my age to definitely be checking your local health department's page, their websites, but also just giving them a call. Also, any of your local hospitals, checking in and making sure you're also following up with that. And then also any urgent cares. Those also have just testing opportunities. They also have different resources that you can take in. Just really be sure that you're advising and watching our government sites, whether that's the Ohio Department of Health as well, because those will have the important and safe facts that you will need to make sure that you are doing what is right for everyone during this time.
It's really important, if we're going to ever get back to where we think normal should be, to wear your mask.
Be wearing your mask.
Wear your mask.
6 feet social distancing.
Keep a safe distance.
Practice social distancing.
Make certain that you get tested.
Getting tested.
Wash your hands.
And hand washing.
And that you also would get the vaccine.
Take the vaccination and encourage others to do the same.
And please get the vaccine.
And honestly, just being kind to one another. Being kind to one another is also another aspect of making sure we're getting control of the virus.
Hello, my name is Lisa Johnson. I serve as the Diversity, Inclusion, and Equity and Employee Relations Director for the Altman Health Foundation. Thank you for viewing this informative presentation. It's vital you're equipped with factual information. The participants answered questions regarding how safe the vaccines are, the importance of the COVID-19 testing, the registration process, and the benefits of continuing all safety precautions. I would highly encourage you to reach out to your healthcare provider or contact your local health department. View informative information at the Ohio Department of Health website or the website for the Center of Disease Control. Thank you.
This presentation has been developed in cooperation with Stark County Community Moving Forward, the Altman Health Foundation, Cleveland Clinic,
Mercy Hospital,
and Ponder Systems Media and Consulting. I can't wait to get my shot, and I'll do that as soon as it's my turn.